So dear audience, welcome. You may know me. I'm Mariangela Pellegrini. I work for the ERN-EuroBloodNet. I'm the Education and Patient Program Manager. And I'm really glad to welcome all of you to this 10th session of our educational program named ERN-EuroBloodNet Topic on Focus for Sickle Cell Disease and Patients and Families and their families. So this is the second last session. This program consists of 11 topics that have been indeed selected by people living with sickle cell disease through a survey we circulated 1 year ago. And I'm very glad to introduce today's lecturer, that is Priapisme. And with us, we have Dr. Rachel Kesse Adu, who was appointed as consultant hematologist at the Guy's and St. Thomas Hospital. And of course, she's a specialist and an expert in sickle cell disease. She's very involved in education, and of course, her area of interest in sickle are cardiorespiratory, chronic pain, and urological complication. So please, Dr. Kesse Adu, the floor is yours. Thank you very much.
Thank you so much. This is a very kind introduction. Okay, I'm going to try and share my slides, she says. So my topic today is priapism in sickle disease. And my name is Rachel. I work at Guy's Hospital. Now, will this let me advance? Cool. Okay, so I don't need to tell this audience what sickle cell disease is. Essentially, you have a condition where your red cells become sickle-shaped, they obstruct blood flow, also get removed out of circulation early and cause all the problems of sickle cell. And I'm pretty sure everyone here knows about most of the problems of sickle cell, but I think we maybe don't talk about priapism in particular as often as we should. So first I thought I'd play a video of an interview I had with one of the gentlemen I look after, who works with sickle patients at Guy's and St. Thomas's Hospital, and I have a particular interest in the urological complications of sickle cell. Do you want to introduce yourself now?
Sure. My name is Camille. I am a sickle cell patient under Rachel.
Excellent. Do you want to tell us a little bit about your sickle in general, how it impacts you day to day?
Yeah. So I think typically it's things like chest pain, back pain for me, and then priapisms as well as of more like recently over the last few years.
Excellent. So obviously the reason we're doing this recording is to try and share some education around priapism, because as you know, lots of young sickle patients know very little about it, and it usually comes as a surprise to people when they have their absolutely first episode. So the idea here is to try and educate about priapism. So following on from that, do you want to tell us a little bit about your absolute first episode of priapism?
Yeah, sure. So I think my first ever episode was probably around 14, 15, something along those lines. And I remember waking up, it being maybe 2, 3 in the morning, having priapism and just not knowing what it was, what was going on, essentially, and not knowing how to get rid of it.
Okay. And how was that managed? Did you end up having to come into hospital at all?
No, so I think my first few episodes, because I didn't know what it was and I didn't know who to go to for it, like I essentially, so my like initial instinct was just to get up and like walk around and try to do exercises to try and get rid of it, without like waking up my family or something, because I wasn't sure and I was kind of embarrassed about what to do about it.
Yeah, absolutely. So inadvertently, you used the right treatment without quite knowing it was the right treatment.
Yeah.
So that means when you had your first episode, you also didn't know what priapism was. No one had ever raised it with you. Okay.
Mm-hmm.
At what point did you then tell your parents and then your doctors about it?
Yeah, so I remember telling my mum, look, this is what's happening. It's not going away, and I don't know what to do. And it was, of course, like, it was really early in the morning, so we, so I had just, said, look, this is what's happening, and because she had come to my appointments with me, at that time, she had helped me bring it up, because I, of course, although I was 14, 15, like I was not like I not the most outgoing person when it came to sickle cell still. So um she did help me like say this is what's happening, or like push me a little bit to say um what was happening at the time.
Excellent. So, how many weeks had you had your priapism before you first brought it up in your pediatric clinic?
I It would probably have been a few weeks. At the time they weren't too frequent. So I probably had maybe 2 or 3 before it was ultimately brought up.
Okay. And how straightforward was that consultation? Did you find it quite difficult, or were you
Yeah,
made to feel quite comfortable discussing it?
well, I think because for me, like because sickle cell and priapisms are I think they're very difficult topics to discuss, especially going through puberty and not knowing what was happening to your body. It's a very difficult topic to discuss in general. So I think now being told, okay, so this is what's happening, made me feel a little better about, now I know what's happening and maybe the possible treatments. And I think for me, like it was, it's still a fairly uncomfortable topic for me to this day.
Yeah, naturally. So then, if you had to tell a 9-year-old with sickle what priapism was, what language would you use? How would you describe an episode of priapism to them?
Yeah. So I think I would probably go along the lines of, as you hit puberty and you start to have erections and as someone with sickle cell, you might have something called a priapism, which is, you know, and use that kind of language. Like I think for me, like even as a 9-year-old, I feel, I wouldn't want to be talked down to. And I think it's very important that that even at a young age, exactly where it is and what would happen.
Okay, fine. So yeah, so the way we describe it in clinic is obviously sickle cell affects your blood. Your blood gets everywhere.
Hmm.
And one of the areas your blood gets into is obviously into your penis. When
Hmm.
you go through puberty, it's completely normal for everyone to have a normal early morning erection. And that's all males, every single man or boy has that from their puberty right through all of adulthood. An early morning erection should not be painful. If it
Hmm.
is painful and you have sickle cell, there's a concern that this may be priapism. So the idea is that if that is happening and it is lasting certainly more than half an hour, you need to tell someone about it. Parents, partner, your doctors, let them know. And the things to do: walk around, have a drink of water, go have a pee, have a warm, not cold shower. Exercise is normally quite good at diverting blood and making priapism settle down. If you had to grade the pain of priapism compared to other sickle pain,
I think for me, like it's a very different pain to me for me, like in comparison to like my typical sickle pain. So like And I think because it is obviously a very sensitive area, like it can be extremely painful, even in comparison to regular sickle pain. So I would probably
Out of 10?
yeah, like
10 out of 10?
yeah, 10.
10 out of 10. Okay, so that was a video I shot with one of my patients called Camille, who's happy to have it used as an educational tool, just trying to talk about his experience of Priapism. I feel we don't talk about it enough. Well, that's my point of view. Let me just go back to my slides now and try and...
Okay, grand. It's really sad because I have a feeling this means there's a video at the end I won't be able to share, but oh well. Right, so this is the biology of a normal penile erection. So within the penis, you have these three chambers, and these two lateral ones are called the corpus cavernosa. They're basically just spongy tissue that can expand and fill with blood or expel blood and then contract down. So for about 23 hours in the day for a normal post-pubescent male, they will be filled, they will have a low level of blood in them, so the penis remains flaccid. But for when the penis becomes erect, what happens is these two chambers become really filled with blood, and then they compress. They put pressure on the blood vessels here that would normally empty them, including all these vessels here, because they get so much bigger. So they reduce the outflow, and that's how you normally get a normal penile erection. And they will normally, they can extend to the capacity of this, this coat here, which is called the tunica. So with a normal erection, you either have vascular signals or neural signals, which lead to the blood becoming engorged within those chambers. And then those signals reverse, so the blood then exits and that penis can become flaccid. What happens with Priapism in sickle is essentially you end up with the blood within the corpora, the large spongy bits, get sickling, which obstructs being able to let go of the blood when you want the penis to become flaccid. And that's what leads to Priapism. So Priapism is essentially sickling in the penis, full stop. So in reality, for the person experiencing it, it's usually described as an unwanted and painful erection of the penis. And if it happens for long enough, can lead to real damage within the penile cavity. Other than sickle cell, there are lots and lots of other reasons why people can end up with Priapism. So Priapism is not unique to sickle, but the ischemic Priapism, the sort of Priapism sickle patients get, the highest presentations are within sickle patients. So medications, regular medications that we prescribe can sometimes cause Priapism. This is in a non-sickle setting. So a blood pressure medication called doxazosin, for example, can cause it. Recreational drugs can account for it. So marijuana can, cocaine is notorious for causing Priapism. Again, this is in the non-sickle setting. There's certain kinds of injury to the penis which can cause it. Spinal cord injury can cause it. Some toxins from spider bites can cause it, and blood conditions, including leukemias, can present with Priapism. But of course, we're here to talk about Priapism in the context of sickle cell. So as I said, with sickle, when you get Priapism, essentially your blood gets trapped because of sickling, which blocks the blood flow out of the penis. So you end up with blood that is low in oxygen, so you don't have enough oxygen being delivered to the penile tissues. That causes pain, same as you would with a sickle crisis anywhere else. And if it lasts long enough, so you carry on not having enough oxygen going to the Priapism, then you will end up with damage to the tissue of the penis. Priapism can happen in two different types. So there's what medically we refer to as stuttering priapism. So you can think of those as sort of like the warning before the big event. So this is when someone wakes up with priapism. It lasts much less than 4 hours, but they can get more than one episode in the one night, or they can get them a couple of nights in the week. And these can be quite repetitive, but they all last less than 4 hours. Obviously, they require, they do cause pain. They may require mechanical interventions to help resolve them. So as Camille described, you can create what we refer to as a steal syndrome. So you basically try and divert the blood flow away from the penis. So if you go and exercise, or I don't know, have a warm shower, sometimes having a pee will help. All those things will try and divert the blood flow away from the penis and help restore the priapism down. But the really worrying priapism is what we describe as fulminant priapism. So this is where someone has priapism that lasts more than 4 hours. With priapism of 4 hours, you should definitely be in a hospital looking for medical intervention to resolve it, because the longer the priapism lasts, the more likely you are to run into trouble. So for example, if you have priapism that lasts more than 12 hours, a third of people will develop erectile dysfunction from that episode and may never be able to retain a normal penile function. And the longer it goes, the higher the risk of developing permanent erectile problems. But once you get over 4 hours, you are starting to damage tissue. So if you present after 4 hours, or you have priapism that lasts more than 4 hours, but say less than 6 hours, there will be some damage to tissue, but you may initially not notice any difference in the quality of the erections. But over time and with accumulation of damage, that can then lead to issues later in life. So what do we advocate for treatment of priapism? So as with all things sickle, keeping hydrated is a good thing. The better hydrated you are, the better hydrated your red cells are, the less likely they are to sickle. If you wake up with an episode of priapism, we always advocate mild to moderate exercise. So most people will go up and down the stairs or do some press ups in their rooms, go down, have a glass of water, go and try and pee. All those things will usually result in resolution of the priapism. And of course, if that doesn't resolve it, you could try a warm shower. And most patients who've had previous episodes can take medication to try and help resolve it, because they will usually have medication at home for it. However, the advice I give to all my patients is, if you hit the 2-hour mark and it's not resolved, start making your way up to the hospital so you get to us before you start entering that sort of fulminant priapism window. And it's important to be aware that recurrent priapism, so just having lots and lots of stuttering episodes, can eventually lead to a degree of scarring, which is what fibrosis is. And over time, that can lead to erectile dysfunction. The real problem with priapism is, as Camille said, is we don't do enough education about it. It's quite a difficult thing for most young boys who are having their first episodes to talk about. There is a lot of female representation in medicine, and it's a problem that uniquely affects boys, and they're having to talk across a gender divide, which can be quite difficult. But it's important people are taught about priapism, made aware of it, because a third of patients who get priapism will end up developing erectile dysfunction if much is not done about it. Despite all I say, actually, we don't have that many treatments for priapism. We don't have a lot of effective treatments. Now, if you present to the emergency department with fulminant priapism, so this is the episode that's 4 hours plus and is still not detumescing, you still have an ongoing priapism, the way you're treated is pretty much as you would for any sickle episode. So you'll get pain relief, you'll be hydrated, you'll be oxygenated. And if none of those things settle the episode down, then they will normally give you an injection of a local anesthetic to the base of the penis, which is called a penile block. So it makes the whole penis quite numb. And then they stick a needle into the chambers I showed earlier, and basically just aspirate the blood out, just literally manually take the blood out, and that can usually restore the flow, normal flow, and the penis will usually settle down. If that doesn't work, then there are procedures that they do in theatre. So these are called shunt procedures, where they essentially do the same thing. They try and make holes of increasing size to try and get rid of the sickle blood. The hematologist usually leaves this to the urological surgeons, but when someone needs to go to theatre, or if we have time, we'll do some blood transfusion before you go to theatre. If we don't, when you come out of theatre, we'll usually do a blood transfusion to see if reducing your sickle blood will help settle the episode. But as you can see, you start off with a fairly small needle size shunt, and if that doesn't work, you move to a slightly bigger shunt, which is a needle that makes a slit within the corpora, and if that doesn't work, then you move to a slightly bigger knife and make a slightly bigger hole to try and get rid of more of the blood. Treating the priapism itself, there are medicines we can give. So when you tell us in clinic that you're getting these stuttering episodes, we do have medications we can give. So there are a couple of medicines. They're quite similar to medicines you take for colds, actually, pseudoephedrine and epinephrine, which help help contract the vascular tissues within the penis to try and get rid of the blood. Viagra, although it's a drug that is given to try and treat erectile dysfunction, there is some small evidence that it can also help treating priapism, and we've had success with a couple of patients in our clinic, but it's not the answer to all problems. And then you can be given anti-androgens, anti-testosterone medications like cyproterone to try and treat priapism, but sometimes the side effect of that is while you're on the medication, it can take away your daytime erections, which is not acceptable to everyone. Then obviously we treat the sickle itself, because the reason you have the priapism is because you have sickle cells. So almost everyone in our clinic who has recurrent priapism is either on hydroxycarbamide or blood transfusion. What space the newer treatments are going to occupy as far as priapism is concerned is, I guess, we're still watching the space, essentially. There is some small and gathering evidence for both of the new therapies, and there's a clinical trial ongoing at the moment using CRIS, which is the infusional therapy, which we're hoping will report in the international meeting in December 23, so next year or the year after, to tell us if crenezolizumab treatment will be enough to reduce priapism. So that trial is recruiting largely in the States at the moment. So in summary, priapism is a painful and unwanted erection of the penis. It can be caused by sickle cell, and within this talk, that is what we're focusing on. If you get priapism, it's important you alert your medical team to it and they start discussing treatments with you, because priapism left untreated can result in erectile dysfunction later in life. If you have an episode that lasts more than 2 hours, it's a good idea to start making your way towards the hospital, because once you breach that 4-hour mark, you start accruing tissue damage. And your medical team are aware of this complication, so please do speak to them if you or your child reports priapism. Now, I'm going to try, because I'm on a different device.
Hi, my name is Leon. I'm 13 and I love
Can you hear the sound?
Yes.
Ah, perfect.
football. I also have sickle cell, which most of the time isn't a problem, but I want to tell you about that one time. You know, in sickle cell, when you have a sickling episode, it's because all the blood cells change from being round to kind of sharp and pointy. And when this happens, instead of flowing smoothly throughout all the blood vessels around the body, some of the sharp, pointy cells can get stuck in the little blood vessels and cause a blockage. The first time this happened was when I was younger. I woke up with terrible pain in my leg. It was the worst. But that's not the one time I want to talk about. You know when I said the sharp, pointy cells can get stuck anywhere? Well, I mean anywhere. And that one time, They got stuck in my penis. Yeah, you heard right, my penis. And that day, when I woke up, my penis was already up before me. Nothing unusual there. It goes up, it goes down. A mind of its own. Usually, it goes down after I go for a pee. Except it didn't go down. Usually it goes down, but it didn't, and it kinda hurt. I had a shower, it didn't go down. I had my breakfast, it didn't go down. And now it really started to hurt, and I only had two choices. Go to school or tell my mom. Yeah, I know, worst day ever. But she was great. She said I needed to go get checked out at the hospital. So I put on my baggy hoodie and I brought a book. When we got there, my mom spoke to the receptionist and we got seen very quickly by the nurse and shown to the room to wait for a doctor. She gave me some pain medicine and put some cream on my arms so that they could do a blood test. I got an oxygen mask. She took my blood and gave me a drip. I still couldn't read my book. When the doctor arrived, he asked me all about my penis, and I told him, it went up, it went down, it went up, and it went down. It went up, but it didn't go down. He explained that if you have sickle cell, this because of the sharp pointy cells getting stuck in the blood-filled spaces in the penis. He said it's normal for blood to go into the penis. It's what gives you an erection. And yes, they go up, they go down. But if they go up and don't go down again, it can be a problem. He said it was a really good thing that I told my mom and we came to the hospital. I felt better with the painkillers and the oxygen, and my doctor said I was lucky because a little bit later, I could read my book. Yup, it went down. I had to stay in for a couple of days just while my sickle cell started to settle down. And while I was there, my specialist nurse came to see me with the doctor. They told me this could happen again. Sometimes it will go up and down, and sometimes it will go up but not go down straight away. Usually, if it happens in the mornings and it doesn't go down when I empty my bladder, I should watch out to make sure that it does. If it goes down in less than 30 minutes, it's all good. But if it stays up for more than an hour and it's painful again, I need to grab my baggy hoodie and come back. They said it's really important that I don't leave it too long. The longer you leave it, the more damage the sickle cell can do to your penis. And we don't want that. So, that was that one time. I hope it never happens to you. But if it does, you need to grab a baggy hoodie and come to the hospital.
Okay, so that video clip is only 4 minutes long, but it took us about 9 months of work to put that together. But although the language is a little bit childish, we chose to make it pediatric appropriate because we figured the earlier you start talking about this, the better. We think adults can still get the information they need from it, which is why it's aimed at peds. And also, I generally find pediatricians don't like talking about anything to do with anything to do with that might have any impact or conversations around sex, just because most of their patients don't need it. So then a lot of the young boys I come across who've had Priapism the first time, they just weren't aware of what it was. So the hope is that this video means you get people before they get their first episode, so it's a familiar thing. That's the hope anyway. Anyway, that's all I had.
Well, indeed, congratulations for the work of the video. Was very clear and I think it targets a lot the aim of raising awareness and giving instruction of best practices to follow in a very simple way. I found it very helpful. We have some time for the questions, and we are going to finish a little bit earlier. So we have two questions in the chat. I'm going to address it. The first one, is there any clinical interference between the treatment of priapism and sickle cell treatments in terms of combined side effects or effectiveness?
I mean, obviously, if you treat the sickle, the hope is that you get less of the priapism. So sickle treatments themselves are a good thing. Hydrea, we think, has a little bit extra when it comes to treating priapism because it may have some effects on the actual blood vessel. That treatments for priapism, so the drugs that we use specifically for priapism on the whole don't affect the sickle cell. So they're these drugs that they're they're basically the side effects of the first two, pseudoephedrine and etilephrine. You can get your heart rate can go a bit fast, and your so you can get palpitations and you can get high blood pressure. So those are the things we watch out for, but it doesn't trigger sickle crises, no, not at all. And with cyproterine, which is the anti-hormone treatments or other treatments that way, I think those who get really severe priapism are generally just grateful to get a break from anything like that. But those who get stuttering priapism can sometimes find it quite difficult if when they're on the drug, they lose daytime erections as well. That can be a little bit tricky, but not everyone does. Everyone is a little bit individual in how they respond, but none of the treatments themselves trigger sickle crises, no.
Thank you. So we'll go straight to the second one. Is there any role for exchange transfusion in the acute treatment of sickle cell disease-related priapism? We don't use it, but I wonder why it wouldn't work.
Yeah, so but priapism is a slightly curious complication. So in my service, I have about 7 or 8 guys who are on exchange transfusion purely because of priapism, because they have problems with priapism. But that is not enough for all of them. So I have some patients who have gone on to exchange and they're fab. They just never get priapism again. But I have patients who are on the exchange program, really well exchanged, who still manage stuttering at home. To be fair, no one on the exchange program ever comes in with fulminant priapism, but some of them still get stuttering. So there is a role that the vascular endothelium plays in sickle priapism that we don't entirely understand, because the pathophysiology of priapism is still, we're still working on it, in all honesty. So when you come acutely, the treatment is urological. We deal with the penis and then we deal with the sickle, because what we want to do is essentially get normal blood flow through that penis, make sure the tissues are healthy, and then we get rid of the sickle blood. So we wouldn't exchange you and hope that's enough to settle the priapism, because organizing an exchange takes a few hours, and what you don't want is for someone to add hours and hours and hours where they have not good oxygen going to their penis. So initial treatment is definitely surgical. They aspirate, get normal blood in, and then if it's not settling, then we sort out the exchange.
One very last question, then we close. What advice would you give to an older patient constantly having priapism and feeling embarrassed even during hospitalization?
I was curious, so because usually we find when people come into hospital, because they receive oxygen, most people are on oxygen, we have much lower episodes of priapism in inpatients. So one of the things I didn't mention there is one of the links we're aware of is people who dip their oxygen overnight are more likely to get priapism. So usually if you're in hospital and on oxygen therapy for a crisis, most people actually have fewer. But I think if you're getting priapism, even when you're an inpatient on oxygen, you definitely should talk to your doctors about it, because there's so many medication options to try, so many. And the other thing with priapism that the medical teams have very little awareness of is people become sleep deprived because of priapism, because they're waking up at 2 o'clock and having to exercise, go back to bed, wake up again at 4 o'clock, exercise again. There's a lot of impact. So just talk to your sickle doctors. They know about it. They will treat it. They will respond in an empathic way.
Thank you very much.